Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So, in the layers of retina, first retinal pigment epithelium. So, retinal pigment epithelium mainly contains hexagonal cells which are firmly adherent to the Bruch's membrane. Bruch's membrane is the layer of choroid. So, if this is the Bruch's membrane, it contains hexagonal cells which are arranged to the which are attached to the Bruch's membrane like this. Then it contains, and it is also attached to, loosely attached to the rods and cones also. It is attached to the Bruch cells firmly, and it is loosely attached to the rods and cones of sensory retina. So here it is attached to rods and cones. Okay, like this. Next it is this layer is important for metabolic support to the neurosensory layer. The other layers of retina are called as neurosensory layers, that is photoreceptors, external limiting membrane, outer nuclear layer, outer plexiform layer, inner nuclear layer, inner plexiform layer, ganglion cell layer, nerve fiber layer, internal limiting membrane. So all of them are neurosensory layer. So this retinal pigment epithelium will provide metabolic support to the neurosensory layer. It is also important in renewal of the photoreceptors. It will replenish or renew the photoreceptors. It is also important for integrity of subretinal space. And this is also important because it can phagocytose the dead photoreceptors. It has even regenerative and reparative capacity is also present for retinal pigment epithelium.
thank you and thank you for watching.